Hi, Jessica.
I
Thank you
did.
for coming to talk to me today about midwifery care. Jessica, well, you know who you are, but I'll just introduce you. Jessica Good is a midwife in Austin, Texas, and has recently started a new practice, midwifery practice, that is a hospital-based midwifery practice. And so I wrote this article about midwifery care and excited to hear about what you're doing right now. And so I'm glad that you were able to talk to me, kind of contribute to this article today. So I just want to have a conversation, ask you a few questions about what you do and about the field of midwifery in general. So is there anything else you want to say to introduce yourself before I start firing questions?
No, that's exactly right. I'm excited to be here and talk more about midwifery care. It's my favorite subject. So I'm happy to talk about
Okay. You know, I think most midwives say that.
it.
It's an obsession, not just a profession.
This is true. Yeah. It's a calling for sure. You have to really want it because it takes a lot of hard work, that's for sure.
That's right. A lot of hard things.
Yeah.
Okay, so first of all, just what is a midwife? I think a lot of people have either never heard the word or kind of have some, thoughts in the back of their mind about what it is, and it's probably based on what they read in a book or something as part of a story, but nothing real life. So, what is a midwife?
Yeah. So the word midwife means with woman, which essentially just means, presence with women. Traditionally, when midwives were first known to be around, they were with women during their births. That nowadays, what that means can be different depending on where you practice and where you get your education. But essentially, we're providers that take care of people with uteruses throughout their life cycle. We do full scope, GYN kind of care. We take care of people through their lifetime regarding birth control and pregnancy care and postpartum care and perimenopause care, kind of all of those things. And people sometimes don't know that because they sort of connect midwives to birth alone. And so that's a good kind of thing to know, is that, you don't only have a midwife when you are getting your care for your pregnancy and then you lose that kind of connected care experience. You can have that through your lifetime. Midwives tend to have a lot of focus around, the philosophy that your life experience as a woman it should be supported. You should be treated in a way that is thoughtful of the different life experiences you go through, birth being one of them, but that, you should be treated as a whole, not just the problem or concern that you're being seen for. And then we have a really big focus around education, preparation, and autonomy in your care.
Yeah. Holistic. So you do, birth care, maternity, and also just kind of, and I don't know if there's a better term for it, but woman care, I guess, is where you kind of what you see a lot, but your checkups, your gynecology kind of checkups and all of it. Yeah.
Yeah. I mean, and, we do a lot of, support around mental health, even though, we aren't therapists. There's a lot that goes into, that part of our life cycle regarding our reproduction and, the starting of that, the having of children, and the finishing of that. And so having, people who care for you, that engage in that from a holistic perspective and thinking about all the different aspects of that life experience. That's what we do.
Yeah. So just to kind of, I don't think I said this, but when I was pregnant, I was under the care of midwives and both my babies and giving birth and postpartum and everything. And that was all I knew. Right. But now that I do the work I do, I see a range of experiences, and it always surprises me to hear that someone didn't have to keep a food journal while they were pregnant. I was like,
yeah.
Why do I have to do this and nobody else does? But yeah, that holistic picture. Okay, so where do midwives work?
So midwives take care of people in all different types of settings. The sort of and it depends on where you're at in the world, I think, as well, because in certain parts of the world, midwives are so common that actually, seeing a medical doctor in your pregnancy is actually the exception, not the rule, right? In the European model of care, that's what that looks like. In certain parts of the US, that's what that looks like. In Texas specifically, it looks very different. And you're right in that, when you talk with people and you say the word midwife, or you talk about midwives, some people that are local to my area have never heard of a midwife before, or only think of a midwife in regards to, like, I want to have a birth at home, in the wilderness in a tub somewhere, And so, not that that is not okay, because that's okay too. But midwives, as far as, they're integrated into different types of models. So for example, in this area, you can have out of hospital birth with midwives, being at your home or in a birth center. And then we do birth in the hospital setting. And that is something that's more rare in this part of the country, but in other parts of the country, that is a very common thing. There are midwives well integrated into every single hospital. I did my training up in Seattle, where midwifery has been a well-integrated system for many years. And there are midwives in all facets, in all of the hospitals that you see there that have women's health care. So it depends on where you're at, where you'll see them. But here, we have them in a lot of different areas. And so what we do is we have a private practice piece, right? The outpatient piece. And then for people who are having their baby and they need care for their pregnancy, we have our care that we provide is in the hospital setting, which doesn't exist anywhere else in the Austin area. So that's why our practice is a little different than what a lot of people have seen here so far. And that is, that's a long story as to how we got there, but they are integrated into many different places. And it sort of depends a little bit on the type of midwifery education you've had as to what areas you may see different types of midwives.
Mm-hmm. Yeah, I mean, it's kind of groundbreaking what you're doing for this area.
It's very exciting. It's quite exciting to be a part of this change that's been a long time coming. I mean, it's needed to be a part of care for a really long time, and I'm excited to get to be a part of it.
Yeah. I mean, I know that there are midwives working in many of the hospitals in this area, as hospitalists, right, on staff at the hospitals, and that's fantastic. But it's not been the kind of care that people could receive for their whole journey, for the prenatal, like you said, the gynecology, and then the birth and postpartum, unless, that just wasn't available really if they want to give birth in a hospital.
Yeah. And there are many places to give birth, and there are great practices that are doing out of hospital birth here in this area that have amazing midwives with great experience. The thing that's been missing is that integrated approach for people in the hospital setting, because some people aren't interested in out of hospital birth, and some people don't qualify for out of hospital birth because they may have something that risks them out of that. And so if there aren't, yes, there are hospitalist midwives, which I used to be in that role prior to starting this practice. It's a great role, and it does bridge a gap for people. And a super important piece to creating more options for people. And it's not a continuity type care, right? Which we know the best model of care for your pregnancy and postpartum journey is to have a model that includes great prenatal care, good education, supported birth experience, and good integrated postpartum care. And so we needed something like this.
Yeah, it's very exciting. Okay, so what is different? Well, okay, first, how about what kind of training do midwives have? So what is it that you have, what kind of education, training to do what you do?
So the type of midwife I am is a certified nurse midwife, which means I get a bachelor's degree first, typically in nursing, though there are routes that you can go without having a nursing background, but that's the most typical way. And then after you get your bachelor's degree, you go back for a master's program and can continue on to a doctorate program for whatever, different reasons. If you're planning on doing research or education for other providers, then that's the route some go. But it's, essentially a nurse practitioner level provider, meaning we have a graduate degree, we have prescriptive authority, and can practice within a certain scope and can have hospital privileges. There are other ways to become a midwife as well. There are other types of programs where you don't take the nursing route and instead do almost an apprenticeship type program where you train under another midwife. You do the didactic education portion, and then you are with other midwives who do out of hospital birth. And those, depending on the state that you're in, are typically called certified professional midwives. Sometimes they're called certified midwives. The old term was lay midwife, but that term has kind of moved out of our verbiage because it wasn't it didn't have a good connotation, a positive connotation, and it decreased sort of the professional nature of that job. And so you now in the state of Texas, you must be certified to say, I have attended a program that has been agreed upon to give me the education I need in order to do this practice safely. Midwives that work in out of hospital birth are many times certified professional midwives, and midwives that do in-hospital birth, but some that do out-of-hospital birth are certified nurse midwives. So certified nurse midwives are the only kind of midwife that can be in the hospital, though only because of that prescriptive authority piece, because we have that background where we're, checked off on this list to be able to do that other piece. Outside of that, it doesn't mean there is less professionalism or less experience. It's just a different kind of experience.
Yeah. Okay. Thank you for clearing that up. I know there's a lot of confusion around the different letters behind the names and what they mean. Okay. So then just basically what's different about midwifery care? Why do some people choose to have a midwife over what's more standard around here, which is OB care for pregnancy and birth?
I truly believe that in the countries and the areas of this country that are doing this well, this type of care well, OB care in general, that when you use the models of care that are appropriate for the person you're taking care of, you get better outcomes. So when we medicalize a model for a person who is otherwise healthy and normal, we increase our interventions and we increase our bad outcomes. When we don't consider medical treatment, when we have someone who's sick, we have bad outcomes. And so really in my mind, the best model to have is a collaborative one where everyone is working within their specialty and an understanding that the OB medicalized model is not better than the midwifery model. It is just different. And that my expertise as a midwife is not less than or lower than an OB provider. It is different. And that I have an expertise that they don't have, and they have an expertise that I don't have. And that we should all sit within that and practice well. And that will be where we make great change in our mortality rates and in our satisfaction rates and in our outcomes.
Right. I mean, one of the things, what's different about midwifery care. So all of that you just said. And so if we're looking at, what is OB care and what is different about that? I mean, they do surgery. They do certain things that are not within your scope as a midwife, right?
Exactly.
And of course, we know how critical that stuff is.
Of course.
And how grateful that we are all the time for that kind of intervention when it's needed. But what you said about that's not always needed, right? Which is great. And when it's not needed, there might be kind of a better model or a different kind of model, depending on the person. But that we have options and that you can work collaboratively as providers. That does look like an ideal world, right? And
yeah, we do need that. I mean, I think having, that is a huge part of what allows me to do what I do, is knowing that I have people on my team that can intervene when something high risk happens, and that can collaborate with me to make sure we're taking the best care of someone, right? Like we need every single piece of the puzzle.
So more specifically though, what's different about midwifery care, like just the basic care, like what does it look like to be under the care of a midwife at your prenatal appointments, at your birth, at your postpartum care?
I think what most people notice when they've had both types of care in their lifetime is that your appointments when you have a midwife, are longer. We talk about a whole lot of different things, not just, checking in on, and I'm not saying that that's only what other providers do, but I'm saying, we really look at all these different facets of your well-being. So our appointments are longer. We have a lot more presence at your bedside. So in labor specifically, and in the postpartum period, there's a lot more presence because, presence and support is what gets us through this giant journey we go through for the pregnancy and birth experience. And then also in gynecological care, like, again, it's that holistic approach. What are all of the things that can contribute to where you're at in your life right now? And how do we look at all those different facets and how they're contributing, not just, symptom treatment kind of care. We like to be really proactive about things and preventative about things. And we like to offer options that include not only just sort of a medication-based kind of care or treatment-based care, but lifestyle-based kind of care. What are the things that we can do with lifestyle and other interventions other than medication that can help promote wellness, not just heal illness.
Mm-hmm. So hence the food diary, the journaling.
That's where the food diary comes in. Yeah, that's where the food diary comes in.
Yeah. Okay. So, and how about in postpartum? Like, what does that look like that might be different? I know that right now, and I've talked to OBs who really wish things were different. But of course, for them and their profession, with insurance and sort of how that's set up and what they get paid for and what they don't get paid for, there's some tricky things there. And so, right now, the standard of care for a lot of people is that they give birth and then they don't get seen again until 6 weeks postpartum, right? So by the OB. I know there's a big push by OBs and professional groups to have more visits be available. But right now, that's sort of what it's like.
So here at our office, we do after we see you through the birth experience. We're checking in on you daily until you go home, but we also have a hospital-based experience. So people are leaving, 24 to 48 hours after they deliver. Whereas at a home birth, you'll have your midwife there a few hours and then they go home, but then they're coming to your home and checking in on you daily for several days and then weekly for a while. So they have very integrated, very present care and out of hospital birth settings too. It just looks different because, someone doesn't stay overnight in a hospital. So for us, that looks like a 1 week visit here in person in our office where we're talking through kind of all of the different things that are going on in that first week. That tends to be a really emotional time and an emotional support visit. We are checking on things like your healing and your bleeding and how's breastfeeding going as well. But a lot of it is about processing your birth experience if you're ready and just talking through the big giant transition that is becoming a new parent. So that's what that visit typically focuses on. And then we also do a standard visit depending on when the person is ready. We do that between 2 and 4 weeks postpartum. And we offer that either in person or via telehealth at our office because you're typically also going to the pediatrician so often that the amount of visits can get exhausting. And usually you don't need as much of a physical exam at that visit. It's again, a very kind of support rounded discussion. So, and then we see them again at 6 weeks postpartum. So we do 3 postpartum visits in that time. And then if anything comes up at all at either of those visits, then we are adding more visits. So if we see you at the 1 week visit and something's not right or going well, then we're seeing you more often still. The problem is not that, I think you were kind of pointing to this in a way. The problem is not that traditional medicalized care doesn't want to include that. It's that care is not prioritized from the insurance side, and insurance companies do not pay for the amount of work a person puts into the care they give. They pay based on this thing called a global fee, which is no matter how much work it takes, it's the same amount. And so for a super busy OB practice, when you have to be thinking about, all of those different pieces when you're thinking about how you're spending your time. And so it's very difficult for physicians. Physicians often want to be able to spend more time with their patients. It doesn't work in that model because they have to meet this bottom line to be able to keep their doors open. And so it's not the fault of the physician, it's the broken system.
And a lot of times midwifery care is out of pocket, right?
It can be. Yeah, at our practice, it is not because of we were able to, get insurance contracts and all these kinds of things. And but in the out of hospital birth setting, it is. It's often an out of pocket expense because many insurance companies don't recognize midwifery care, especially in the out of hospital setting, as worth covering. I know why, but that's a different discussion for another day. Mm-hmm. But also, another crazy piece of this is that in different states, midwives are recognized as either being kind of like giving the same kind of equal care versus not counting as much. And so, for example, in the state of Texas, certain insurance companies, if I do a vaginal birth versus if a doctor does a vaginal birth, I get paid 15% less just because the letters behind my name say CNM and not MD when we're doing the exact same care. So things like that are also parts of this really complicated puzzle that is the medical system in America. But again, another discussion for another day, I guess.
Yeah, I do a weekly support group that's virtual, just like this, and on Fridays. And I get people, for some reason, I get people often from the UK, from London. People will call in at their dinner time, even though it's like lunchtime here, and talking about pregnancy and birth topics. It's just sort of that kind of support group, and that's just the conversation where they're talking about their prenatal care. When they're talking about their birth, it's their midwife. It is just the standard care. Unless, of course, they need some kind of a different kind of intervention, right? A higher level of care for a higher risk situation, a different level of care, I should say. In that case, of course, they're under the care of an OB or an MFM. And so that's, but it's just integrated into their medical system. That's okay. So do you think that right now, okay, there's a big disconnect. There's some things starting to come together. You've seen it different in other parts of the United States. You've seen a better integration where midwives and OBs are working together in collaborative ways. It's a more integrated part of the medical system. Do you see a further integration into our medical care system, into our structure right now? Do you think that's coming soon, or can you even picture that happening?
Ours as in Americas, or ours as in Austin, Texas?
The United States, let's just say.
So, I mean, yes and no. I would say there has been a big shift in recognizing that the system is broken, and that what's happening now isn't quite working, right? So in regards to an eye to statistics that the US keeps up with, like maternal morbidity and mortality and access to care and things like that, there is a recognition, because when you look at the evidence, you see that midwifery care is a huge component to reducing risk of everything and increasing likelihood of all the good things. So, I think that there's that recognition piece is happening actively. There's a lot of talk around that, and how do we integrate that, and how do we bring more of that model into existence. In addition, there is an old antiquated system and change is hard, and the people in charge of making change are sometimes not super excited about said change. It's like the governmental system has all the kinds of rules that are really antiquated, and those need to change. And then the hospital systems have rules that need to change, and the state legislators need to change. So it's just all these different levels, and so that's why it always takes so long.
Yeah. And I think something that I included in this article, if anybody's reading the article first, is that in the United States, we have huge gaps in care, huge maternity care deserts. So yes. Huge regions of the country that don't have obstetric care available. So people, when they get pregnant, they can't go to an OB. They can't access that care. They have to either drive really far or just not access medical care. And, some of that is what contributes to our less than stellar maternal mortality rates and morbidity, and even infant mortality and morbidity. And so I think that's something that's not really well known. And I know that there's a big push, a lot of midwives and that profession, people in that profession, working to fill those gaps in community birth settings, providing the well woman care, providing the maternity care in these like maternity care deserts. And so I'm hoping that can definitely be part of the picture. And I know that might be part of the incentive to change some regulations and to make some big changes so that at least these gaps can get filled. And then, maybe maternity care can integrate midwifery care in a bigger way in all places. But I know that there are amazing midwives out there filling these gaps in these community birth settings that are really successful, have and really improving care and the rates. So I definitely have so many good thoughts and feelings about midwifery care. And so you specifically, I'm excited to see this because I know when I was looking to have my own babies and choosing my maternity care, I have 2 teenagers now, and in Austin, there were fewer options. I mean, at that time, midwives weren't delivering babies in hospitals. Mm-hmm. That wasn't even a thing yet. So in my time of having children, I've seen some pretty big changes, but yours is a kind of like the next big step. So I think you kind of already described though, how you're bringing the maternity care to Austin. That was my last question.
Mm. Yeah. I mean, I think the only, I feel like I was lucky in that the role, I went out of private practice and decided to take this hospitalist job at this local area where I had had my admitting privileges and been delivering babies for several years in private practice, and then decided to take a step back from that because it's very labor intensive and I was working a ton and I had my kiddos and wanted to have space to be a mom essentially. And so starting, that was the real start to this journey, even though back in that time, I did not know that's what was happening, because that hospitalist position and getting into the system in a way where midwifery could be seen as an important piece to the puzzle, taking over, I managed the group there of midwives and got, seats at the table with these important people that were administrators at the hospital and CEOs and all those kinds of things. And after I built trust there from people knowing because I think there's a lot of underlying kind of falsehoods about midwifery and what it means and what it can offer. And there's this sort of thought that maybe it's not safe, or that people doing this type of care are kind of cowboys working outside of the norm. And so in that role, I was able to break down some of those barriers and help people understand, like, you're missing something here. Like, you're missing that this is what people in Austin want, that they are looking for this specific type of care. And if you don't do it, someone else will. And you have this opportunity. You know, the hospital I'm at was doing a big renovation, and they included this space within the hospital that has kind of a like birth center like environment on a different floor with bathtubs and queen size beds and kind of all the bells and whistles of what they call an ensuite midwifery unit. And getting that moving, and then sort of making those relationships and having the conversations, like, was a 6-year-long process, but here we are. And I think that, I have those people in the system to think in a way for listening and hearing the need and trusting me to make it happen, and trusting me to make it happen in the right ways. Because without them, it wouldn't, right? Without having built those relationships with probably people that I would have thought to myself would never advocate for these kinds of things. It went both ways, because, I had fear about being able to trust that they would let me do it the way that it needed to be done to be the right model of care, because it required that of me. It required them to trust me that I could build it, because it's different and it's new. And the midwifery model means seeing less people in a day, and it means not running back and forth from the hospital, and it means sitting at a bedside. And that is not the model that the system is used to here in this area. So, it took trust from both sides, and I feel really grateful. I'm glad I went for it. There was a time where I was like, no, not me. No, somebody else. But now I'm really happy.
Yeah. Well, I mean, I'm happy too. And I know a lot of other people in this city are happy too. And I can say that I've been part of conversations at other hospitals and systems where this is a conversation.
Mm-hmm.
There is acknowledgement of the importance of midwifery care, the midwifery model of care, about the importance of making changes to the current structure. And I think that what you're doing, taking that first step, is leading the way, success there, leading the way, kind of making a path for others to kind of follow. And so I think hopefully this is just going to be the first of more.
Yeah, I mean, that's the goal, right? Midwifery should be everywhere. So I'm super excited, because that's what what speaks to the people in power is, what do people want and what are they willing to invest in. And so seeing the amount of people running to this option lets the other hospitals in the area know, hey, wait a second, this is something real. And the goal is that, right? The goal is that there's midwifery access in every hospital in this area, and not just this one lone place you can go to, that this is integrated into the system, and that we grow and change through this. And this is hopefully just the first step for many awesome things to come.
I agree.